Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, October 22nd, giving you the update from Albany Med. We'll jump into the first graph here. This is the 8 counties of the capital region. We're currently looking at 54 people being treated for COVID. That number is the number that we talked about on Tuesday. It is definitely trending up from the last couple weeks.
Yeah, so Dennis, we had our call yesterday with the 12 hospitals.
Right.
And I think the number was 61.
Right.
So
Okay.
definitely up.
Let's go inside Albany Medical Center. Our morning census here is 12. We have 9 on the floor. We have 3 in the ICU. We have 1 on a ventilator. And I think we mentioned this earlier in the week. The youngest person is 21. Most of those people are in their 50s, 60s, or 70s.
That's right.
Fred, we've talked many times on this video that we are not a hospital. We're actually an academic medical center. We're different. We are the only one within 25 counties. We have 3 missions. We do education, we do clinical care, and we do research. And today we'd like to announce an update on something we spoke about actually a couple months ago, about really some incredible research that's being done by some people here at Albany Medical Center, along with the University of Wisconsin, that is directly involved in COVID.
So Dennis, this is a paper that was published in one of the very prestigious journals that are out there. Our investigator is Dr. Janovitz, one of our pulmonary critical care docs, who also has a grant to do basic science research.
Can I say one thing? So he's a doctor, he works at the bedside, and then he goes into the lab and does research.
And that's what's so valuable about the academic medical center, taking discoveries or getting ideas to go back to try to come up with discoveries.
So bench to bedside.
That's right. So this study is kind of cool. They took blood samples from 102 patients of ours with COVID and did mass spec analysis on their blood and identified a bunch of markers. Actually looked at 17,000 different proteins and other kinds of chemicals in your blood to identify what correlates with what we call hypercoagulability, or essentially damage to the blood vessels that might cause a blood clot to form, which we know is one of the problems with COVID. So really quite interesting, as I said, published in a very prestigious journal. There have actually been some calls to us about this from the media and other investigators. So really quite good.
So congratulations to Dr. Janovitz and everyone who worked on that. It really is remarkable. You know, Fred, we spoke about CAR-T earlier in the week, and a couple people stopped me and said, that's really incredible, some of the scientific breakthroughs that you guys are either working on or treating people with at the medical center.
It really is. It really is phenomenal.
So staying with that academic medical center theme, let's talk about the education piece. Last night we had a journal club, another one, and the topic last night had to do with heart damage related to COVID.
So there's something called myocarditis, Dennis, and this is an inflammation of the heart muscle that, if severe, causes heart failure and can even cause death. So there have been reports that COVID can lead to, in many cases, mild myocarditis, or that inflammation of the heart. Some cases maybe more severe. So the medical students actually did a literature search to cross that with the athlete and see whether or not there's any data out there on myocarditis and athletes, and really to make some recommendations about how we ought to counsel them about when is it safe to go back to physical exercise. So it was really a very, very good journal club. I'd say that there's not a lot of data. There are some schema of how to evaluate an athlete, so college student or high school student, but nothing firm yet in terms of how to go about evaluating them.
Well, probably more literature in the future, but in the meantime, the journal clubs continue with active participation not only by our faculty, but by our students and members of the community. So that's wonderful.
It was well attended last night.
You know, Fred, before we get off the COVID topic and move on, we speak a lot about ways to prevent COVID with social distancing, wearing masks, washing your hands. We've talked a lot about testing. We talk a lot about therapeutics that are being brought to the market and the vaccine. You know, you mentioned athletes and stuff. I just think it's important for us to spend a couple minutes reminding people that really there are things that we can do ourselves to make ourselves healthier, and that's important with COVID. So there's a recent study that came out of New York City that looked at people who are hospitalized with COVID. So these are people who are sick enough to come into the hospital. And of those people who are being treated in New York City with COVID, 60% had high blood pressure, 40% were obese, and 30% had diabetes. And as we know, there are things that we can do really that will help reduce our risk factors for all 3 of those diseases: healthy eating, regular exercise, not smoking, taking your medications. And I think it's important. That's one of the reasons why I hope we can see a safe way to open up health clubs and gyms, or people can find safe ways to exercise, because it really will make a difference, not only with COVID, but with other diseases. But since we're talking about COVID, it's been proven it will reduce your likelihood of being admitted with COVID.
Absolutely.
Yeah, so we really want to mention that. So let's segue over to a couple months that we want to celebrate. There's people who work in our organization. They either have a day or a week or a month, and I think one of them is celebrating an important month.
Well, Dennis, so we'll stay with the physical activity theme.
Yes.
This is National Physical Therapy Month.
Outstanding.
And, you know, the physical therapists in our institution help people get back to normal activities.
They do.
It's really important, even when they're still somewhat acutely ill. Being somewhat active is helpful. It helps them to heal and get better quicker. So shout out to them. Congratulations for everything you do for us.
For sure. They're involved often with people who've had strokes, people who've been in traumatic accidents, people who have medical conditions, and they've been in the hospital for a long time. Our COVID patients, I know they've worked very carefully and closely with them.
It even makes a difference in patients who are critically ill in the ICU.
Correct.
There's something that they can do to help them be a little bit more mobile.
Next group we want to highlight, it's Infection Prevention Week, and we have, I've said it many times, a world-class group here. We currently have 6 infection preventionists. We also have a director of epidemiology. We have an epidemiologist, infectious disease doctor who leads that group, data analysts, administrative support. Just one number, Fred, they have 143 years of experience collectively working in this area. And since the beginning of the pandemic, they've actually done contact tracing on over 616 patients or staff, which is remarkable. Many times they look at 9, 10 different data sets at the same time to try to figure out what's going on with patients. And they're really remarkable. And one other thing, they did not drop the ball. So while they were working on COVID, they also continue to do all the work they do looking at catheter infections or bloodstream infections or surgical infections to do whatever we can do to keep that number down. So shout out to them.
If you ever needed evidence of how high quality our EPI group is, the past 6 months of COVID, that's the evidence.
They sure are.
Terrific job.
Anybody else we want to highlight this week as far as specialists?
How about the pharmacists?
Pharmacy.
The pharmacy is a really important group here, and I don't think we've talked about the pharmacy. The pharmacy is a 24/7, 365 component of the hospital here, and they're servicing not only the inpatients but the outpatients in the facility. There are over 160 employees in the pharmacy. Pharmacy is led by Anthony DeSpirita, one of our young up-and-comers in terms of leaders in the organization, and I think it's important. It's really important work. Recently, we refurbished the outpatient pharmacy.
Been there myself.
It's beautiful. The facilities folks did a great job. It's a heck of a lot more functional. I was there this morning, and it's for the benefit of our patients, but also for the benefit of our employees.
For sure. And speaking of them, in the beginning of the pandemic, they quickly figured out a way to get medications outside for rapid pickup, so people didn't even have to come in the hospital.
That's right.
So we're glad to highlight them as well. All right. Any other topics for today?
Looking at my list here, no, I
didn't think so either.
I think we covered it.
I just wanted to be sure.
Yeah.
All right, very good. So we'll be back again on Tuesday. We're going into the weekend. We always like to thank our workforce, who we know will be here over the weekend taking care of patients, and we'll pick it up then. So we ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.